Okay, let's make a start. If you can find a seat. Welcome to the Advances in Research and Innovation stream of SNOMED CT Expo 2022. My name is Peter Groves-Williams. I'm a technical specialist at SNOMED International, and I'll be moderating today's session. All questions will be answered at the conclusion of the presentation. Online attendees, please use the Q&A box to type your questions to the presenter. On-site attendees, please use the microphone that I'll be wandering around with later. I'm now pleased to introduce Salvador Lima Lopez from the Barcelona Supercomputing Center, who will be presenting development of deep learning-based NLP resources for occupational health, employment status, and activities using SNOMED CT. And I do apologize, we've not been able to get Salvador his clicker for this presentation.
No worries.
As of yet, we're still working on that. Salvador, please proceed.
Hi everyone. As he said, I'm Salvador Lima. I'm a computational linguist working in the Barcelona Supercomputing Center, and I'm here today to talk about occupational health and natural language processing. Next, please. Well, first, I'm going to be introducing the Barcelona Supercomputing Center and my team, and then I will be talking about why occupations and how exactly did we detect and normalize occupations. Next, please. Okay, so about us. Next. In case you don't know the Barcelona Supercomputing Center, we are a public research center in Spain. Next. Can you do next 2 times? Because sorry, I have some animations, so I'm going to be saying next a lot. We are a public research center in Spain. We do work on computer sciences, life sciences, earth sciences, etc. And we are probably best known because we are the house of the Mare Nostrum supercomputer, which is one of the most powerful in Europe. Next, please. Another one. This is our group. We are the Biomedical Text Mining Unit. We are a part of the Life Sciences Unit, and we focus mainly on information extraction and entity linking. And what we normally do is we release data and annotated data so people can train artificial intelligence systems in Spanish for biomedical content. Next, please. Next. Next, sorry. Well, here's some of our work, just very shortly. We've done work on cancer pathology recognition, Spanish clinical coding to ICD, disease recognition, anonymization, etc. Mostly in Spanish and Catalan. Actually, the first one, Cantemist, we will be having a talk about that later. My teammate Eulalia will be giving a talk at 2 or 2:30, I'm not sure. Next, please. Well, so why did we choose occupations? Next. In case you don't know, there are some, I think all of you know probably, but there are some conditions that are not necessarily related to health, to medical conditions, which are social determinants of health, and they are related to where we live, what we do for a living, the places we live in, the people we relate with, etc. Next. And next, please. These include, as I've been saying, education, living situations, financial situations, access to healthcare also, etc. Next, please. Next. So occupations are also one of the social determinants of health. They can have a great impact in our health status, and not only our occupation, but also our workplace, the conditions in our workplace, the social relationships with our teammates, etc. Next, please. Next. So, according to the International Labour Organization, every year there are like 340 million occupational accidents and 160 million victims of work-related illnesses. So it's a serious situation. Just to give you some examples, next. These are some of the most obvious. Next, please. Some of the most obvious health-related situations related to occupations, workplace accidents, exposure to toxic substances and pathogens, and also mental health-related issues, which are also becoming more and more important every day. And here are some examples of this type of content in SNOMED. Next. So how do we do about mining occupational content? Well, actually, in unstructured data like electronic health records, biomedical literature, clinical reports, there's a lot of occupational information, but it's not so easy to access. Next, please. There's actually a field that's dedicated to it. That's called occupational data mining. And it tries to improve workers' quality of life by extracting this content. Next. And here's where natural language processing can have a great impact. Next. So how did we exactly extract this occupation from unstructured text? Well, there aren't that many resources for occupational data mining in general, not only in Spanish, but also in English and in many languages. Next. So we had to create our own. And it turns out that occupational information is more complex than it might seem at first, because it's not just job titles, but there's also information about company names, people, places, skills, etc. So we tried two different approaches. The first one was to do a, next please, to do a dictionary-based approach. And the other one was to do a deep learning-based approach, which is a little bit more complex. Next. So what are dictionary methods? Dictionary methods are, we need to use them to just try to find them in text. So what we did was we gathered occupation from SNOMED, but also from DEX, which is the Spanish version of MESH, ESCO, which is a classification for occupations, which I will talk more in depth about later, and also WordNet. And we created a dictionary with a lot of job titles and occupations, and we used it to try to find these occupations in clinical case reports. Next, please. Next. Next. Okay, so what are the results? Next, please. This approach works really good for some parts, but not so good for others. The thing is, dictionary methods and string matching methods are really easy to use. They are not really computationally expensive, so you can do it with little resources. And they have a decent coverage because there are really a lot of job titles per se. But it also has some downsides. Next, please. The downsides are there are a lot of false negatives. We found that it was really easy to find job titles, such as, I don't know, doctor or florist, but the more descriptive occupational information was missing. And we also run into a problem that's probably specific to Spanish and maybe to Romance languages. And that is that many of the words used for occupations can be nouns and adjectives. So for example, clinician, clínico in Spanish can mean clinician, the occupation, but also clinical, the adjective. And this happens with a lot of words, so, which means that we have a lot of false positives. Next, please. So we tried to go to some more complex methods, that is deep learning and neural networks. And these systems are able to learn from the context and distinguish what is an occupation and what isn't. And this means that they could help solve some of the problems that the dictionary methods have. But they require annotated data to learn. And as I said, there's a lack of resources in this field. So what we did was that we created our own. And we created a dataset, annotated dataset called MEDDOPROF. Next, please. So MEDDOPROF is it stands for Medical Documents Profession Recognition, and it's an annotated dataset of case reports in Spanish that we presented last year in the Spanish Natural Language Processing Conference as a shared task that is a competition for artificial intelligence system. Next, please. Next. Next. So here's an overview. There are almost 2,000 clinical case reports that we annotated. They were manually labeled by clinicians, but also by linguists. And we annotated not only professions, but also working statuses and activities, that is hobbies and stuff that might seem like they are occupations, but they are not actually occupations because they're not paid. And the inter-annotator agreement, which is a metric of the consistency of the annotated data, was 0.9. Here's a link to the data set in case you want to take a look at it. And next, there are some examples. So you can see they're in Spanish because the corpus is in Spanish. So you can take a look at how it looks. We have very simple occupations like oficinista, someone who works in an office, but we have some more complex occupation like working from home, trabajar desde el hogar. And next, please. And also some working statuses like being unemployed or living being homeless or receiving no pay whatsoever, etc. This kind of information that's also really important and related to occupations. Next, please. Here's what we annotated in the corpus. I'm going to go over it really quickly. We have on the upper side, we have the 3 different types of occupational information that we annotated: professions, which are paid occupations, then employment statuses, socioeconomic and occupational statuses, and also this type of non-paid activities, or I don't know, playing basketball or being a volunteer or playing in a band. And what we did also was that every of this annotated information, we classified according to whether it was about the patient, it was about a family member, a clinician, or someone else. Okay, next, please. And to do this work, what we did was we created a document called Annotation Guidelines that describe how exactly we have to annotate this content. These guidelines are 33 pages long. They have over 70 rules and exceptions. They're also freely available. And next, please. The next step that we wanted to do was, now that we have these occupations, if we really want to make the most of them, we need to normalize them, to assign a code to them. So next, please. All of the mentions, or most of the mentions, are normalized, both occupations, working statuses, and activities. Next, please. And we use 2 different terminologies, SNOMED CT, and also the European Skills, Competences, Qualifications, and Occupations Classifications, ESCO. Actually, ESCO and SNOMED are not the same because SNOMED is a terminology and ESCO is a classification. So this has some implications that I will discuss now. So next slide, please. What exactly is ESCO? ESCO is a classification, so it identifies and also categorizes not only occupations per se, but also the skills, competences, and qualifications related to them. And it also has relationships between all of this type of information. And all in all, it has descriptions for 3,000 occupations and almost 14,000 skills, all translated into 28 languages. It's based upon a previous classification created by the International Labour Organization, which is ISCO, which is pretty similar, but not adapted to the European market. And next, please. Here's an example of what ESCO looks like, right? We have codes, descriptions for every occupation, alternative labels, some regulatory law aspects, and also the related skills. Next, please. So why did we use ESCO? Isn't SNOMED enough? Actually, it is. There's quite a lot of occupational information in SNOMED. We have occupations. Next, we have working statuses. We have activities like sports, etc. We have aspects related to occupations, like these types of facilities in workplace, escort in the workplace, and also this type of problems related to working statuses, like having a stressful work schedule or having bullying problems at work. So why did we choose ESCO along with SNOMED? Well, the thing is that ESCO is a statistical monohierarchical classification, which was helpful because it allowed us to recover more information than SNOMED in some senses. And it also includes descriptions and essential skills. Next. So the descriptions really helped us be able to normalize some of the occupations, which can be really, really vague in this biomedical content. And next, please. As I said, the hierarchical aspects also allow us to recover the occupations field, because ESCO is a classification and it's divided into different fields. So we know, for example, that this occupation is related to health and this one's related to, I don't know, being an accountant. And we also wanted to work with skills in the future. So it also gave us a vantage point. Next, please. here's another example of the skills and competences in ESCO. As you can see, they are quite comprehensive. There's quite a lot. And this could also be helpful for some of the normalization, automatic normalization systems, which might struggle only with a code and a descriptor. Next, please. So some statistics. We normalized almost all of the occupations to ESCO, and that is like 3,100 mentions with 297 unique codes. And to SNOMED, we normalized occupations, employment statuses, activities, and that amounts to 444 unique codes and almost 5,000 mentions. So since we did the manual normalization of these codes, I wanted to share some of our insights about the occupational content in SNOMED. I could talk a lot about this, but I'm going to give just some simple examples. For some occupations, it can be pretty straightforward to do the manual normalization. For example, gardener can be found as is in SNOMED. Others require you to think a little bit more creatively, to think of synonyms or where you could rephrase the occupation. For example, something like beekeeper, you are not going to find beekeeper in SNOMED, you're going to find apiary worker. This gets even harder when you do it in the Spanish version, which has some strange translations. And then for some of the very general occupations and for more descriptive occupations, we lose some content and we have to settle with a very general code. For example, collaborating in a family business, which is something we could find in an electronic health record. That doesn't have a code in SNOMED, so we have to use like a very general worker code. And there's also the problem that some codes can be quite similar, even if they are not in the same SNOMED branch. So for example, we have head teacher and teaching principal. We're not sure what's the difference without a description, right? And in Spanish, these are actually called really similarly, which complicates stuff even more. Okay, next. Okay, just to summarize what I've been talking about. As I've said, occupations are one of the social determinants of health that can shape our lives. Everyone has an occupation, and if you don't have one, it's a big problem in today's society. And clinical information is very rich in this type of content, and also in its related content like work-related diseases and exposure to toxic substances, etc. Simple methods can be useful to extract this information, but to really make the most of it, we really need to extract, to use neural networks. Next, please. Some of the next steps, just very quickly. We want to expand the corpus by including more granular information, also exploring how exactly interoperability and cross-mapping would work between ESCO and SNOMED, because they are both rich in their own sense. We've also trained some automatic detection and normalization models, and we've used them in real electronic health records. And we found really interesting results, some information that can be really specific and that would surprise you. And we're planning to release these models in the near future. And for some more specific use cases, we've also started developing co-occurrence networks. So what do occupations appear next to in text? And we want to use it to explore occupation in the context of biomaterials, which is a project we are starting to work on, an European project. And also about cardiovascular diseases, which is also one of our interests. Next, and just to finish, here's an example of what a simple co-occurrence network would look like. So for example, an occupation like psychiatrist or psychologist is closely related to terms like ludopathy, anxiety disorder, OCD, etc. This is a really simple, very obvious example, but we can find more complex information the further we look into it. Okay, so next, just to finish, I want to thank the rest of my team who couldn't be here today, as well as Eulalia, who is also in my team and is here. Also, there's SNOMED CT organizers. And just to finish, the work I presented here today was publicly funded by the Spanish government, especially the Plan TL, Plan Tecnologías del Lenguaje, and research and development project. Okay, so that's it. These are some useful links in case you want to take a look at what I just presented. And that's it. Thank you, everyone, for paying attention. And if you have any questions, I will.
Okay. Thank you very much, Salvador. Do we have any questions here in the room? Question at the back.
Thank you. There seems to be also an overlap between the expressions that can be made or the inferences that can be made out of the classification in comparison with those that can be made from the SNOMED content, I'm sure. How did you manage that? And you talked about that you would create a map between the classification and SNOMED CT. And did you do that? And how did that turn out? And then my third question would be something like, if you would start over with this project, would you leave out either, and you could only use one of the two parts, which one would you prefer, the classification or the terminology?
Well, we're actually exploring how to do the cross mapping, because there are different resources and different types of resources. So you can do a one-to-one mapping between both. It would be like putting the SNOMED codes in boxes, in the scope boxes. So we're exploring how to do that exactly. There's also occupational information in other terminologies, and it would be interesting to create some kind of meta thesaurus with all of this information, but it's a lot of work and we're just exploring it and see where it leads. And if we had to choose, I think it's hard to choose. I would probably choose SNOMED because it also includes the working statuses and activities that are not in ESCO, because ESCO is focused only on occupations per se. And I think SNOMED in that sense is more complete. I don't know if I answered everything. Yeah. Okay.
Thank you. Any other questions here in the room? No, if not, I'll check if we've had any online.
You have my email here. In any case, if you want to write me or anyone in my team, you can write us and I'll answer gladly.
I have a question here. Could you say something about the relevance of social determinants of health?
Well, there's actually a talk about that later. I think it's at 2 about social determinants of health and interoperability. I think it's a really interesting field that's understudied. And it's actually everywhere because it relates to our education, to the people we relate with, to our work. So it's something that we just can't ignore, because if some things don't just come up from nothing, they have like many types of interconnections. So I think it's interesting to explore all of this, especially in unstructured data, because it's not the kind of information that's put in structured data, like lab reports or I don't know.
Thank you, Salvador. Well, with that, we will conclude this session. Thank you, Salvador. Online delegates to join another session through the event lobby. On-site delegates, if you are playing our event game, scan the QR code by the door to capture your attendance. Thank you very much, everyone. Enjoy your next session.